The situation is basically horrific. We only had 3 ICU beds to support nearly 1 million Palestinians, which was incredibly insufficient.
So Doctor, first off, could you tell us a bit about yourself and your role with PANZMA?
So my name is Wajid Khan. I'm an ICU specialist. I've been for about 5 years in Sydney, and recently with PANZMA and Islamic Relief, I've just come back from a mission from Gaza.
So Doctor, obviously the situation in Gaza is quite dire. What would you say is something that the people on the ground need the most, and what can we do to help them?
The situation is basically horrific. There is a lack of not only medications, equipment, medical and nursing staff, but also there's now not enough food and water to even feed the patients within the hospital. So particularly in northern Gaza, which is being completely destroyed. Just recently, the hospital that I worked at was bombed, Al-Ali Hospital, and we only had 3 ICU beds to support nearly 1 million Palestinians, which was incredibly insufficient. The steps that we're taking in collaboration with Islamic Relief and PANZMA is sort of a multi-prong approach. We've done a need assessments during this medical mission. We've liaised with the local doctors and well aware of the needs in terms of equipment that they require. After we're able to fundraise the necessary amount of money, we would look at acquiring the equipment, and then in collaboration with PANZMA trying to get that equipment to northern Gaza, most likely Shifa Hospital, where an old building is being refurbished to provide critical care services to both pediatrics and adult patients.
And finally, those who are not on the ground like yourself, those who are watching, what is a message you can give to them in terms of what they can do to help?
I think that one of the most important aspects going forward would be to support this collaboration between Islamic Relief and PANZMA so that we can actually provide basic critical care services to the Palestinians in northern Gaza. One of the most important projects sort of going forward at this current moment.
Doctor, thank you very much for joining us. It's an honor to have you here and to share your insight and stories from being in Gaza. We hope that this project is successful. Our brothers and sisters in Gaza are given the medical aid that they need, inshallah.
Thank you for speaking to me.